It is such a pleasure to be with you all today, even though it's by video. I'm sorry I can't be there in person, but I'm so glad you all are gathered, and I'm so glad I have this opportunity. It is a thrill for me to be the lead sponsor of H.R. 1384, the Medicare for All Act in the House of Representatives. And I have to say, we introduced it about 11 months ago, and we have seen tremendous momentum. And it is because of the movement across the country that is continuing to push for Medicare for All. We have had 4 hearings in the House of Representatives. That's historic. We had not had one hearing on a single payer bill in all this time in the House. Now we've had 4. We have over half of the Democratic caucus as co-sponsors on the bill. We have 119 co-sponsors. We have over 30 labor unions that have come together and said that they understand they're giving up wages by having to bargain for health care benefits at the table, and even those are costing their union workers more and more. We have a racial justice coalition and a fantastic Businesses for Medicare for All coalition that has been pushing. In addition, the movement across the country has been passing resolutions at city council level, at the county council level, and that momentum and that energy on the ground for everybody to have health care as a human right, not as a privilege for the wealthiest few, but as a human right, is really what is fueling our success to date. Well, we have a long way to go in making sure that this actually becomes law. I would just say that this is a dramatic transformation of a healthcare system that has been constructed to put profits over patients. We have to deconstruct that. And the way that we continue to get our co-sponsors in the House, ultimately get a Senate and a president that can sign this into law, is all about the work that happens at the grassroots level to educate people and to fight back against the hundreds of millions of dollars that for-profit insurance companies and pharmaceutical companies, who are the only ones benefiting from our current system, we have to take them on. And that, I think, is going to be a fight. But everything that we've ever gotten in this country, whether it was the right to vote for women, whether it was ending slavery, whether it was sending a man to the moon, has taken a movement to make that happen. One of the things that I find most disturbing is the way that some of our presidential candidates are picking up talking points of the private for-profit drug companies and insurance companies. And one of the things that gets said sometimes is that Medicare for All is going to take away choice. Well, I want to say a couple of things about that. First of all, there are 70 million people in the United States of America who are uninsured or underinsured. They literally have no choice at all. People are trying to decide if they're going to pay for their for their food on the table, for their groceries, for their mortgage, or if they're going to get the prescription drugs they need, or the cancer treatment they need, or the insulin that they need. They are making these horrendous choices, those are real choices, to not get the care they need because they do not have a healthcare option. But let's talk about the people who do have health insurance, perhaps are lucky enough to be covered by their employer. Well, they too have very little choice. They don't pick the plan that they are on. Their employer picks that. They don't pick the benefits that they get through that plan. The insurance company picks that. They don't get to pick which doctor or hospital they get to see, because there are all these in-network and out-of-network hospitals and doctors, and surprise billing from an out-of-network hospital or doctor is becoming a massive problem across the country. And let me tell you this, if you end up leaving that company because you're too sick to go to work, because you have to stay home to take care of a family member, maybe you want to go start a business, then you really have no choice because you have no health insurance. Medicare for All is about giving people real choices. The idea that if you want to start a small business, you don't have to worry about where your health care is going to come from. If you want to work for a different employer, you don't have to worry that perhaps they're not going to offer you the health care that you want. If you don't have health insurance because you're not employed, you don't have to worry because you will have your health care provided to you. Not just a few things here and there that leave you with enormous bills, $12,000 a year that the average American family is paying in out-of-pocket costs, deductibles, and premiums, but actual health care that covers the things you need. Long-term care if you get sick, or if you have a disability, or as you get older. We need to make sure those folks are taken care of. We need to make sure we're providing reproductive care for people across this country. We need to make sure that we're providing dental and vision and hearing benefits for people as they age. Comprehensive care. When you get sick, hopefully before you get sick, and that will not only bring us a healthy population, but will dramatically reduce the cost of sickness in this country and a for-profit system that puts profits over patients. The key factors for a successful Medicare for All program are, number one, it has to cover everyone. Everyone in, nobody out. Number two, it's got to provide a comprehensive set of benefits. We want people to really feel taken care of in every way and to have their health care attended to in every way. Number three, it needs to address cost. It has to bring down the cost. Just imagine that in the United States of America, we spend, according to the most recent research, 5 times as much on administrative costs as other countries around the world that are similarly developed to the United States. Just imagine that in the United States of America, we spend $3.9 trillion on healthcare. That's about 18% of our GDP. And that number is set to increase so that we will spend $55 trillion over the next decade paying for healthcare. 30 to 34% of those costs are all administrative. And that's because our healthcare insurance is administered by these for-profit insurance companies, by hospitals, that we don't have any cost controls there. So Medicare for All has to take on the question of cost. Well, it's a great question about the public option that keeps coming up. And I'll tell you that when we were fighting for the Affordable Care Act, a lot thought that maybe the public option could be an alternative if we couldn't get what we were fighting for, which was Medicare for All, single-payer health care. But what I have come to really see as we've seen the enormous administrative costs ballooning since that time, only projected to increase even further, is that a public option is not going to fix the problem. It will not transform the system for a couple of fundamental reasons. Number one, a public option will not cover everybody. As long as you have a private system operating next to a public system, those costs are going to continue to go up. There is no cost containment in a public option, in a Medicare buy-in, in any of the other plans that are on the table. So don't be fooled into thinking that a public option is going to get us to the results we deserve of everyone having affordable health care. It doesn't control costs and it doesn't cover everyone. It also, by the way, none of the public option plans I've seen have actually expanded benefits. We should not have seniors having to pay additional money for another insurance plan that covers their dental or their hearing. We need a comprehensive set of benefits, and none of the other plans do that. Medicare Advantage for All is the same idea. It sticks with a system that was created and continues to operate for profits instead of patients. So again, you might be able to, with a Medicare Advantage plan, with a public option, with a Medicare buy-in, you might be able to slightly expand the pool of people that are covered, but you are not going to address overall cost. You're not going to address underinsurance. You're not going to change the fundamental way the healthcare system operates, which right now, there are so many Americans who never think about going to see the doctor because they know they can't afford it. So they wait until the very last minute. Our concept with Medicare for All is completely different. It's that you actually see healthcare as a right and not a privilege, and therefore your behavior fundamentally changes and the costs fundamentally change. So all of those things have to be a part of the solution, which is why Medicare for All is the only comprehensive plan to provide truly universal quality health care to everybody in America. I think the thing for me about working on Medicare for All, and it's been a passion of mine that we should be able to provide health care to everybody, we are the richest country in the world. We are a country that should be able to ensure that everyone has affordable, quality health care. And we are a country that should recognize the economic benefits of moving to a Medicare for All system that does not allow profit to drive whether or not somebody gets the treatment they need. This is one of the most resilient ideas I've ever worked on. I will tell you, with hundreds of millions of dollars in opposition coming at us, the reality is the recent polling shows that 70% of independents, 80% of Democrats, and a decent percentage of Republicans, swing states, Democratic states, Republican states, believe this is the right thing to do, because we don't have to explain it. Everybody's got somebody that they know who couldn't get the care they needed, sometimes with terrible results, sometimes losing people that they loved, sometimes going into foreclosure. 500,000 Americans, 500,000 Americans every year declare bankruptcy because they can't afford the cost of health care. And so I would just say to those of you in the room who are providing care, who are working in these systems, who desperately believe that the United States of America can do this, you are right, and it's going to take your energy, your knowledge, and your commitment to ensure that we get Medicare for all in the United States of America.